family program here at the Beachcomber consists of 2 family sessions per week. Tuesdays and Saturdays are the family program, Tuesday evening from 6:30 to 9 and Saturday afternoon from 2 to 5 p.m. The family members are invited to come and visit with the patient. Each family session has a family group as a part of its component. So for 1 hour in the middle of each session, there is a family group, which is educational in nature. Primarily, it's about educating the family members. A lot of, if not the majority of families come in here not really knowing anything about addiction as a disease. So we educate them about addiction. We educate them about addiction as a family disease. Also, as a part of the session, there's a family counseling component, so they have an opportunity to meet one-on-one with a counselor and sit and talk about any issues relative to the family members. Some of the topics that we covered during the family program are education regarding substance abuse, education regarding addiction as a family disease. We educate on skill building, how to improve communication, how to set boundaries. We teach the family members about different roles that they may be playing within the family to help to sustain the addict's behavior. So we not only are focused on educating and helping the addict to recover, but a big part of it is about the family member and helping the family member to recover from their own addiction, which is being addicted to helping or being addicted to controlling the addict's behavior. Many of our patients come to treatment knowing very little about addiction as a disease, let alone addiction as a family disease. At the Beachcomber, we make it a high priority to have the family involved in the patient's treatment. The patient has a much greater chance of maintaining their sobriety if the family members are involved in their treatment. And that's because the family members often become just as addicted as the patient does, not to drugs, but they become addicted to somehow controlling the addict's behavior. They become addicted to wanting to fix the addict. So we help to educate them on ways in which they can change to help support the success of the addict, because it's not just about the addict having to change their behavior. It's about the family, the system as a whole having to make changes, because if there's just one change within the family system, it's going to affect a change within the whole family. So if you have a patient who is working on changing themselves, and then you also have the family members who are focusing on their own self-care, and they're learning ways in which they need to change in order to stop sustaining the addict's ability to continue to use, then there's going to be a much greater chance of success.